All right, welcome to option 2, clinical presentations of the Nipah virus. So for the incubation period, 90% of the time it's between 4 to 14 days, but some literature suggested that it can be 45 days. 11% of patients affected with it remain asymptomatic, and initial symptoms that we typically see are fever, headache, cough, sore throat, breathing difficulties, vomiting or diarrhea, muscle aches, jerking, or muscle weakness. As we progress into more severe symptoms of the infection, we trend into involvement with the central nervous system. So we see neurological involvement like sensory abnormalities, abnormal pupillary reflexes, vasomotor changes, myoclonus, meningitis, and diffuse encephalitis. We also have respiratory symptoms like atypical pneumonia and ARDS. And other severe findings that we see are septicemia, renal impairment, GI bleeding, and disseminated intravascular coagulopathy as the infection progresses into multi-organ dysfunction. And then after infection, there are also what are called sequelae. And so sequelae are latent effects of viral infections. And what we see here are relapses or delayed encephalitis, psychiatric symptoms, and neurological disorders. So in terms of vaccination and treatment is mainly supportive care. Some researchers are using antivirals and like ribavirin and have found that there was a 36% reduction in mortality and an increase in survivors without neurological deficits. There are currently no licensed vaccines, but some vaccine trials are underway at Oxford University and the National Institute of Health. And so what they're doing with these vaccines is taking a vaccine for the Hendra virus, which comes from the same Henipavirus group, and are infusing it with the same glycoprotein from the structure of the Nipah virus itself. So diagnosis of Nipah virus infection can be done through either PCR or ELISA, and those samples are taken from either the cerebrospinal fluid, throat or nasal swabs, and blood, urine, and saliva. And so that is the clinical presentations, diagnosis, and treatment of Nipah virus infection. Thanks for watching, and have a good day.